Hello, everyone. Welcome. My name is Kelly Armstrong, and I am going to share with you today some information and a presentation on the Dolphin NeuroStim and our new Vagal Up accessory kit. So some of you may already be using the Dolphin NeuroStim, but this is a whole new treatment, something totally new and exciting. And some of you, this may be new too. So I will walk you through what it is quickly, some other ways that we're already stimulating or shifting the nervous system, shifting the parasympathetic branch of the nervous system into a more robust place. So there can be more healing and more shifting. And I'm going to walk you through what the vagus nerve is, why it's important, who could benefit from this, and then I'll show you quickly how to set it up. It's easy. It can be a passive treatment, and it's just amazing. We're so excited to have it and I'm excited to be teaching on it. So at the end of my presentation, the last slide will have my email on it. So be ready to write that down, because you're welcome to shoot me an email, contact me, and I can help answer other questions maybe about the product or get you set up for other webinars that you may be interested in learning about the Dolphin NeuroStim or NPS therapy. Okay. All right. Well, I will see you when the presentation is over. Okay. So I'm going to go ahead and set up my slides. Okay, all right, everybody, thank you for being here. We are going to talk about nervous system regulation. And what does that mean? Specifically, we're going to talk about vagal nerve stimulation, okay, which is now becoming a very exciting thing in the medical world, right? Because it's very healing. Okay, so what is regulation? It is so important that you understand the nervous system. So what we have tried to do as a company with the Dolphin NeuroStim and NPS therapy, which is microcurrent point stimulation, and it is a pain management therapy, right? So that's really what we teach. All of our different classes using the Dolphin NeuroStim, and the points and the protocols are for pain management, but we know, and we have found over the years, that it really helps to do so much more. It's wonderful for wellness. And over the last 6 years, during our research studies and pilot studies, we have found out so much about the nervous system. And because we're using an electrical device, we can actually decrease stress and improve parasympathetic activity. So I'm going to share with you, I'm going to take you down a little road. I'm going to paint a picture for you of the nervous system and where the vagal nerve stimulation falls within that nervous system balance. Okay, but when you look at yourself or your client, you're always looking at, or you're always reading their nervous system. Like you just by, what symptoms they have or don't have, or how their body is in balance, is giving you a picture of what their nervous system is doing. So the autonomic nervous system is a control system that acts largely unconsciously and regulates bodily functions such as the heart rate, digestion, respiratory rate, pupillary response, urination, and sexual arousal. This system is the primary mechanism in control of the fight or flight responses. Okay, so what happens when the nervous system is regulated? That just means that there is a balance. Okay, so when you look at the scales, right, we always want to keep that body and those systems in balance, particularly the stress that comes in. We want to be able to manage that so that we have a balanced nervous system, which would look like health, wellness, recovery, typical development, peace or mood stability, and just homeostasis. Okay, so that's really what we strive for. It's what we want in our life. And it's definitely what we're trying to give and provide our patients or facilitate in our patients' journey, right, as they're coming to see us as practitioners. So what does the nervous system look like when it is not regulated? Okay. Well, there is disease and illness. There is endocrine dysfunction, pain, trigger points, tight muscles, sensory spectrum issues, anxiety, PTSD, mood disorders. So this is what you're going to find, you know, when you PubMed articles on disease, you're going to see stress, you're going to see sympathetic upregulation, because that is the imbalance of the nervous system. When the nervous system is in that sympathetic state, the longer it is held there. Okay, so obviously our bodies go into sympathetic states when we need to use them for things, right? For survival and for shock, and, you know, when we have to get our energy all going to do something. But naturally, that sympathetic stress should come back down. So in periods of prolonged sympathetic upregulation, there becomes an imbalance in the nervous system. Okay. Okay, so this imbalance can actually be measured. Okay, so we have in our research over the last few years, if you have been to any of my courses or heard me speak at other times, you will have probably heard some of the autonomic nervous system testing measurements or markers that we teach about, because what we want to do as practitioners is we want to create that functional change through whatever techniques it is, whatever type of practitioner you are, whatever techniques you're skilled at and you know are your toolbox. You want to pair those physical manual, you know, pain techniques with a shift in the nervous system. And that is the key for better outcomes, okay, in your patient. You have to think about the body electrically and being able to shift that so that those functional changes that you can make through those manual skills you've learned can hold, and they can be better, okay? And they can be more lasting and more fruitful to the client. So health can be measured scientifically. We have used autonomic nervous system testing with our protocols and with our dolphin neurostim electricity. And we have also tested endocrine levels in lots of our samples of research. We have done both of those, and we actually have done more than that with brain scans and thermography and other test measures, but these have been consistent ones. The autonomic nervous system testing has allowed us to really see how 3 of those markers show us functionally as pain management practitioners what's happening in the body and what our goals should be. So those top 3 markers that we like to look at are stress. Okay, so stress can be measured autonomically or through endocrine saliva or blood samples. The parasympathetic function is a marker, and heart rate variability is a marker. That's the HRV. And we've talked, where I teach a lot on heart rate variability because it is the overall marker of the nervous system. So when you look at autonomic testing, you want that marker to be at a good level, you know, or above. What that means is that you have good power electrically in your nervous system to deal with your everyday, you know, stressors or activities that come in. It means it shows a variability. It shows that the body has power to respond properly. And there are actually PubMed articles that say if you have low heart rate variability, then you actually will not respond well to illnesses and sicknesses or traumas that if you have good heart rate variability, you're going to recover and you're going to live long. Okay, so that's a really big key marker when you just look at autonomic nervous system testing. It just tells if the body's going to be able to recover, and it can actually predict. It is used, that number is used in science, in the medical field, for predicting health and recovery. So that's really interesting. But these three are the three big autonomic markers that we look at, and we want to be able to balance these and shift these and improve these. Okay, so research is measuring vagal tone and noting it as a function of heart rate variability. Okay, so remember I just showed you the three, stress, parasympathetic, and heart rate variability. Well, when you read articles, scientific articles about vagal tone, you will see that vagal tone impacts or is part of the overall heart rate variability, okay? The HRV, heart rate variability, is a measurement of the autonomic nervous system, and HF is a specific measure of vagal tone, okay? So HF represents high frequency, okay? So if you want to jot that down, high frequency is the actual measure of the vagus nerve when it is being used in autonomic nervous system testing, okay? The vagal tone has been widely recognized for the last 20 years, okay? So this, guys, is not something new. This has been something that's been measured, it's been used. You see a lot of autonomic nervous system testing around athletes and their performance, because they're always trying to improve their performance and push that edge, recover that nervous system. So vagal tone, stress, parasympathetic, heart rate variability, these aren't new measurements, but the vagal tone has become super popular in the last year, okay? And that is because of COVID, okay? So when after COVID hit, the things that it was doing to the nervous system, to the inflammation process in the body, they began to really, see what in the body, if it's working efficiently, how can that help wellness, or how can that help to decrease inflammation? And it was the vagal nerve or vagal tone that has been brought up medically and talked about a lot. So if you're not sure, if you haven't heard that, then jot those words down, go back and just Google some PubMed studies. There have been thousands and thousands of papers that have been released over this last year, over the pandemic of COVID, and what this parasympathetic stimulation can do and how it can help improve the functioning of the body. Okay, so this is huge, because this is still where we are, right? Like in our society, like we've been here for a long time now. We are all treating patients all of a sudden with that maybe have had COVID. Maybe some of you may be treating, acute respiratory, we can just say that, like it doesn't even have to be COVID, right? There's a lot of cold and flu and respiratory symptoms with that. But in the last year and a half, where we are as practitioners, is we have a lot more clients who have these, what they're calling long haul symptoms. And it has to do with those organs, with the lungs, with the nervous system, with the immunity, with the heart. So the vagal nerve, or the vagal tone, goes right in directly and is responsible for stimulating and producing enough electricity to run those organs, okay, in that part of our nervous system. So that's why the vagal nerve has gotten so much attention in the last year and a half. So cytokine storms were recognized as a main cause of death. And again, that's something else that you can look up, but it all goes back to stimulating the vagal tone and the vagal nerve and that electricity, because that is a treatment for those issues in the body. Okay. Now, this last point, I want you to really, really listen to. Okay, there is an article at the bottom of this that is an amazing article. So if you like to PubMed and read things, this is definitely one that you need to check out. But this statement, this last little bullet point, high vagal activity is indexed by greater heart rate variability, independently predicts reduced risk of GBD. GBD is global burden of diseases and better prognosis. Okay, so what it's saying is high vagal activity, right? So you got good vagal tone going on in your body that supports good heart rate variability. And by a good, strong heart rate variability, you can reduce the risk of diseases and you can have a better prognosis. Okay, this bullet point right here is amazing. You have to understand what I just said, and that comes directly from the study at the bottom of the screen. Okay, so it is an amazing article. It has a great abstract, and it really just lays out, why do we want good vagal activity? Because we don't want to get sick. We want to have better immunity. We want to have better prognosis. Now, if you're able to add this to your clients, to yourself, to your family, then that is an amazing treatment that you're getting for yourself or that you're giving as a practitioner. Okay, and the science is everywhere. Okay, print out a couple of abstracts to put in your office, or to share with patients who maybe they come to you because they're fatigued, or their muscles hurt, or they don't have as much function as they did, because of the sicknesses that nervous system immunity issues that they're having. Vagal nerve stimulation will be wonderful for those clients. Okay. Okay, so this is a picture, okay? We like to look at pictures, right? It just helps us to understand. This just goes back to that balance, the sympathetic versus the parasympathetic. You actually see a picture of the organs, and you can just read, again, what that activated system will help or coach those organs to do. Okay, so sympathetic, fight or flight, obviously is when we're stressed, right? Whatever reason that stress is, it doesn't matter. For MPS, we are always teaching, those scars, the traumas, the tight muscles. We're targeting our clients in a physical treatment, but there's other stress, there's emotions, there's toxins, environmental toxins, so there's all kinds of things that have come in. And I definitely think that, in this last year, year and a half, we see that stress of all those different stressors really impacting health in a way that maybe we didn't see so globally before that, So the vagal nerve, when it's inhibited, you're going to see dilated pupils, inhibits saliva, increases heart rate, bronchial dilation, inhibits digestion, stimulates glucose release, inhibits intestinal activity, secretes epinephrine, norepinephrine, relaxes bladder, orgasm, ejaculation, and vasoconstriction peripheral. So you're going to see issues with all of that. Okay. If you look at the other side, which is what we want to stimulate, we want to support the parasympathetic because we want to rest and digest. So this requires good, strong vagal activation or stimulation, okay? And it just does the opposite of all of those. Constricts pupils, stimulates saliva, decreases heart rate, bronchial constriction, stimulates digestion, stimulates gallbladder, stimulates intestinal activity, contracts bladder, vaginal lubrication, erection, peripheral vasodilation. So you have just both sides to what happens. And we have all been in fight or flight. We all know what that feels like when you're sick, when you don't feel good, when you're irritated, things aren't working right, and then you're able to, shift that into more of a wellness place where you're feeling better, the systems are working. So this is the goal. This parasympathetic rest and digest is the goal. Even if you're working on pain management and you're working to loosen tight muscles and to change a tight skeletal system, you're working on parasympathetic rest and digestion. That's what the nervous system has to do, because that's the place that we relax. That's the place where balance comes back and energy moves. And that release of stagnation for wellness takes place, okay? But when we are in that sympathetic fight or flight, what that stress does is it affects and releases cortisol into the body. And this is a nice little picture that you may have seen in some of our teaching, but it just helps you to see. So like what patients do I see, or what are the symptoms that the patients have that come in that are in sympathetic fight or flight? Well, probably all of our patients have some of these, okay? Decreased metabolism, depression, hypertension, chronic fatigue, sleep issues, migraines, vision issues, reflux, hostility or mood instability, hunger, arthritis, decreased immune system. Okay, so these are things that's happening. We may not be treating all of these things, right? Some of these things may not be particularly in our scope of practice, but they go hand in hand. They come from stress. They come from sympathetic upregulation. They roll out down through the body physically, and it just becomes the cycle, and muscles and tightness and pain is mixed in all of these symptoms. And that's what stress does to the body. It increases pain because it upregulates the nervous system. Okay, so what I want you to know, what I want you to be able to do in your language, or when you're talking to a client, or just when you're understanding it yourself, I want you to be able to use these terms in the black over here, the black area, interchangeably. I want you to understand how to describe the nervous system. So fight, flight, or freeze is sympathetic upregulation. That's an imbalance in the autonomic nervous system. It's sympathetic upregulation, okay? And remember what happens in that fight, flight, or freeze. Our healing system is not working because it's trying to deal with whatever stress is going on. So there is sympathetic upregulation. If there is sympathetic upregulation, then that means automatically, right? Remember the scale and the balance, that there's low parasympathetic regulation. So that would say to you that that person does not have a good, robust, recovery system, or digestive rest, recovery, stability in their body. So that's what you want to shift. Or you can go another notch down and say they have low vagal tone. Remember that sympathetic system, that is low vagal tone, that is low parasympathetic regulation, and that is sympathetic upregulation. Okay, I know that a lot of times when I'm teaching and we're going over research, people ask, well, what is the sympathetic upregulation? What is downregulation? What is a balance, right? So all of these things represent that system that doesn't have enough power electrically. Okay, now this is apart from the muscle pain and just the mood and the depression and all of those things, those symptoms that we see. But this is what's going on electrically in the nervous system. Stress creates negative changes in the physical and emotional body, okay? So that can come out as pain, disease, emotional instability, And it can all be related to the vagus nerve. Now remember, the vagus nerve is part of that heart rate variability, okay? So the vagus nerve, or the vagal tone and parasympathetic marker or function, makes up the heart rate variability, that big number, okay? So these are diagnoses, actually, that are listed in PubMed research that are related specifically to the vagus nerve, okay? And there's probably a whole lot more, okay? But these, as I was reading through research and I was really seeing what is linked, it is amazing. So guys, if you just take, like 20 or 30 minutes and you do a little bit of research and get on some of those medical articles, you are going to be shocked at how it's already there. It's been there. It's been, but now there's a lot there, even currently. So COVID is linked to vagus nerve stimulation, chronic disease, decreased immunity, increased muscle tone. Okay, so that right there, if you are just looking at muscles, right here is an additional way to help decrease the muscle tone that you're fighting in your patients when they come in and you're trying to shift things and you're trying to do your manual work to relax those muscles and improve their functionality and decrease their pain, okay? Lung issues, cardiovascular issues or diseases, mood disorders. Okay, I'm just gonna say that right in the last year and a half, most of the world has to have mood disorders at this point. We have been up and down and stressed about not just, one thing in life, but now there are so many things. There's jobs, there's money, there's, what are the kids doing? There's the health of our kids, right? Like, in such a different world, the political, just the communities, like there's just so much instability with mood regulation that this is incredible. This is actually linked. Depression is actually approved by the FDA for vagal stimulation. Okay, now there are other, I'm talking about an accessory kit that we can use passively on the outside of the body, but some of these diseases are actually approved for internal vagal stimulation use. Okay, so this is serious. This is really amazing. Depression, obesity is a really big one. Cancer and diabetes. Diabetes is really big also with the vagus nerve, which then takes us down into the gut. So gastrointestinal issues, which then when you get into the tummy or the abdominal area, think about how many scars we have down there. So this is so exciting because we know that the scars can block some of that function, and pairing this vagal nerve stimulation with our scar release is incredible. I think it's just gonna it's gonna soar as a treatment, like in the body, make big changes in the body. We're already seeing. So gastrointestinal issues, the brain health fog or brain fog, right? So that gut brain connection, the vagal nerve comes down from the brainstem, from the medulla, comes out. It's bilateral on each side of the neck, okay, under the ears. And then it's going to go down the front of the body all the way to the bottom of the abdominal cavity. So, so we want that stimulation of that nerve to be functioning all the way down the length of it, right? So we'll talk a little bit more about that in a second. And tinnitus, this is a really big one. This is one of the questions that I get a lot as a practitioner from healthcare workers is tinnitus. And we're finding, well, it's actually linked in literature to brain fog, to cognition, to tinnitus. So that is very exciting, again, because this is an easy passive treatment. And these are some very serious diseases that the medical world has linked to vagus nerve stimulation. Okay. Okay, so just a little bit more about the parasympathetic system. It is the healing, it is the recovery, it is our immunity, it is our rest, digest, and repair. Okay, So it's very cool, right, that we have recovery and immunity linked together in the same system. Because when your clients, like, obviously we always want to suggest that you make sure that you stay within your scope of practice. As we have lots of different scopes of practice that come and learn MPS. And a lot of people who just come and purchase the products, and this is definitely one of the, this vagal kit is something that people are purchasing and using, on their self at home, because, it's passive and they can apply it easily. But, you may have somebody coming in for recovery of muscles or recovery of, some type of skeletal, dysfunction, but that electrically, when you're doing this, you're improving the tone of those muscles and the recovery of those muscles, but you're also improving their immunity, okay? And it really, that is probably the best thing that we can give someone today, is improving their immunity. So here's a few things about the system. Parasympathetic nervous system consists of the nerves and the ganglia outside the brain and spinal cord for, again, healing, recovery, and don't forget your immunity, right? The vagus nerve is called the wandering nerve, and it is the longest nerve in the body. Okay, so again, it comes from the brainstem, it comes out from the medulla, it's bilateral, so it comes out under both ears to the side and the front of the neck. So going through those, those neck muscles sometimes are super tight from just poor posture or from disc issues or from whiplash or injuries. And those really tight muscles in the neck can actually be inhibiting the function of this vagal nerve because of where it comes out. So, as the nerve comes out through the neck on both sides, it then goes down the chest, down, the torso, and to the bottom of the abdominal area. So it's a very long nerve, and its goal or its job is those organs in the front of your body for parasympathetic function. The vagus nerve controls about 80% of the parasympathetic system. So when your heart's fluttering, or when you're out of breath, or when you're nauseous, the vagus nerve has something to do with those symptoms and how well everything is in balance. Okay. Vagal nerve stimulation reduces stress, therefore improving vagal activity can improve health. Okay, this is another really nice study at the bottom. It talks about inflammation in the study, and it says the nervous system controls inflammation. And recent discoveries have identified the role of a major vagus nerve mediated physiological mechanism, okay, the inflammatory reflex in this regulation. So if you want to just talk about inflammation in the body, then you need to be looking at stimulation of the vagus nerve. Super exciting to have this knowledge and how you want to add something to your treatment for your clients. Okay, so what is MPS therapy? So some of you guys know what MPS is and some of you don't. So welcome to those of you who this is new to. I'm so excited to be able to introduce it to you. MPS is microcurrent point stimulation. And we are inherently, what we are is a pain management system. We use a small electrical device. I'll show you a picture of it in just a minute. It's handheld. It is direct current microcurrent, okay? And that is the key to the amazing changes that this little device makes in our body and facilitating healing and change in our body. We use it traditionally. What we do is we have protocols of all kinds of different pain issues and wellness issues and things that we're treating, and we have protocol points for that. So in our live classes, we would teach those. now with COVID, we still haven't quite reverted back to that, but we do have some online classes, and we have some webinars that you can connect with a teacher. I'm one of those teachers, and we can take a couple hours and go into something, and you can still have some leading and guiding and some, help, digging deeper than, just what you can read. So, so that's kind of where we are with our education, but our protocol points are acupuncture points, motor points, trigger points, and they are also traumas and scars. Okay, so that's basically what you'll be treating when you hear MPS protocols and what we teach. Now, we have published lots of papers in the last 5 or 6 years. So we're very excited about that. And a lot of that some of it has to do with pain, and some of it has to do, well, I guess pain isn't all of it really, but a portion of that also includes measuring autonomic nervous system changes, which is what we've been talking about so far, and how the dolphin neurostim makes those changes, and even comparing those changes to other TENS devices or other types of electricity. And what we have found out is that there is a very different response in the body, in the nervous system, in the autonomic reaction to different forms of electricity. Okay, so again, MPS is direct current microcurrent. MPS is known in some of the literature that we have published as MA, or microcurrent acupuncture, because that is a description of what we're doing. Although we're not using needles, okay, let me just, if we're using the device, the electrical device on top of the skin, on acupuncture points, motor points, trigger points, so it's not invasive. It's not done with needles, it's done with the dolphin neurostim device. Electroacupuncture, or EA, is the application of concentrated alternating current. Okay, that's opposite from direct current. So those two different electricities have very different modulating effects on the autonomic nervous system and on stress levels. Okay, direct current microcurrent reduces stress and improves cellular healing. Alternating current milliamperage increases stress and does not have cellular. Okay, so just be very clear, this is one of the big things that we teach when we're talking about the nervous system and the electricity. We want you to very much understand that all modalities are not created equal, okay? They do not do the same thing or have the same modulating effects inside the body. Now, microcurrent itself, if you don't know a lot about microcurrent, definitely Google it, look it up. It is amazing for the body, okay? The human body acts as an electrical bioenergetic system. All of our cells in our body are like little batteries, right? They're all electrical. So you have to put in the right electricity to get the body to improve and to heal and to regenerate. And that is what microcurrent does. It mimics the body's own human nervous system, and it promotes electrical balancing of cells. Okay, so it's very important to understand. This is really why our MPS scar work works so beautifully, because we're getting that direct current microcurrent directly into those cells, into that tissue for relaxation, for healing, for cellular change. Okay, so research shows that microcurrent enhances components or variables to healing, okay, particularly ATP. It increases ATP when you use direct current microcurrent on the tissue. It increases protein synthesis in those cells, and it increases the metabolism in those cells, so that extracellular movement in that matrix is affected by the use of microcurrent. Microcurrent can increase oxygen and circulation to the muscles, and it is a powerful biocellular healer and a supercellular accelerant for repairing the body. And guys, I can't say that enough. I use this scar treatment, which I'll show you in just a sec. Like, I'll just touch on that. I'm not going to teach it, but I am going to mention it because of its effects on the nervous system. This will decrease stress in the body electrically. And you are getting such amazing changes and healing of those local cells when there's trauma or old scars or, you know, tight muscles. So microcurrent is a super, super healer of tissue. But the key, this is what's so amazing. So it's not just for that local effect, okay, for that tissue that's bruised or cut or has surgery or has an old scar or tight muscle or inflamed joint. It's not just for that, but microcurrent shifts the body naturally by its scientifically. What the electricity does is it shifts the body into or creates more of a parasympathetic state. So you have, when you're using the devices, you have a local effect coming out of the tip because you're using it either on scars or, you know, traumas or on points to release muscles and activate or release something. But you also are getting a parasympathetic shift in the overall electrical system itself. Okay, so it's amazing. Okay, so this is what the kit would look like. Okay, so for those of you who don't know what the dolphin looks like, it's this little white device right here. And this would really be the kit if you're new and you're just wanting the dolphin to add to yourself or, you know, for your clients for the Vagal Up kit, you really only need one device. So you could purchase a single device dolphin. It does come with a book of protocols for pain. And then this section right here is what the Vagal kit includes. Okay, so it has some pads, which I'll tell you about in just a minute. And it has the actual vagal part is this little ear clip, okay, that also attaches to our unit. It comes with a Vagal Up book. Okay, it's geared towards upper respiratory COVID recovery because in Canada, that is actually now what the company can say about this Vagal kit is that it is approved by Healthcare Canada for COVID symptoms, which is amazing. And then it has a couple of little charts to kind of help you get started, which I'm going to share with you today how to get started. Now, just to let you know, if you're interested in doing the scars, if you don't have any dolphin neurostim and you do want to invest in this and begin using this on yourself and your clients, you can either purchase the one dolphin, okay, which you can do single points, and you can use the Vagal Up accessories, or you can purchase a kit that has two dolphins, and that would allow you to also incorporate and treat the scar release. Okay, so just to let you know, there are kits with two if you also want to add the scar releases to your treatments. Okay, so this device has been our newest release. We're super excited last year when we were able to begin to sell these dolphins. These are white. Okay, many of you, if you've seen the dolphins or if you have older dolphins, then they will look a little bit different than this. But this is our newest dolphin. It is called the Professional, and it has a new feature. So that's why I want to show you the difference in the older dolphins in this new one. Okay, first of all, you can mix and match the dolphins if you have an old one and you purchase a new one. The electricity, the intent of the dolphin is the same. That hasn't been changed, but what has been added is this additional little black button right here, okay? And what this does, you still use the dolphin the same. It has a point finder in it to help you find or locate the point of low resistance, which is the acupuncture point or motor point that you're looking for, okay? And historically, you just have to press the button to deliver the current. Our treatment time suggested are 20 to 30 seconds for our protocol points. You can do a little less, you can do a little more, depending on, how your client, how much time you have, and, what's going on with your client, if they tolerate it well. But then this is the new button, okay? And when you push this little button, what it does is it makes the beeping or the sound on the dolphin go quiet. So we call it the silent button, okay? So for about 20 seconds, it will be quiet, and then you'll hear a beep, and then it will go quiet again, and then it will go beep. So it still lets you know that it's on, okay? It's not like completely silent, but that beeping or that chirping no longer is heard. So you don't have to use that. You can use the professional, just like the old ones, where you have the sound on and you hear it in your endpoint finding mode, just like, all of the dolphins before have been. This is just a new added feature. And I will say it is amazing because you can silence the sound when you want to. Okay, so it's your choice. But this is what makes it so amazing with the Vagal kit. You can, when you make the sound go off, so you engage this little button, the unit goes into a continuous treatment mode. Okay, so what that means is that you don't have to actually be pressing the treatment button to have the electricity coming out of the unit. So that allows us to add the Vagal kit, like the Vagal accessories, and that's what makes what allows the Vagal treatment to be a passive treatment. Okay, so I'll show you what I mean over here. Okay, but first, real quick, I just want to show you, and then we'll get into the Vagal kit will be the fourth way, but we already have ways that if you are doing MPS or you're learning MPS, we are already increasing vagal tone. I want you to know that, like, the vagal nerve stimulation is so powerful and it's amazing because it's passive, but we're already shifting the nervous system. We have been teaching this. The things that we have been teaching and you are learning and maybe even doing, you're still getting that nervous system shifting. Okay, so I'm not going to teach these first three, but I want you to be super aware of other things that you can learn with MPS, but that these treatments are increasing vagal tone and decreasing stress too. Okay, and the SCAR protocol is of course one of those things. So we get so many changes with the SCAR protocol. It reduces stress, and this is autonomically measured. Okay, so like this has been done with autonomic nervous system tests. So it's not just, we're not just saying that, but it's been measured scientifically. It reduces pain, which we always measure, right? Because we are pain management. And it reduces scar tissue. And we can say that because we have a study being published that actually is used for the ultrasounds to measure the gray mean depth under the skin of the scars, and it reduces in a single treatment. Okay, so so your SCAR protocol, when you're treating scars, is tapping into that electrical system, reducing stress, increasing vagal tone, and increasing heart rate variability. Okay, this is another MPS treatment that it's very well loved. We use it a lot. It is called the Golden Triangle. We definitely teach to use these 3 points on the wrist. So this would just be done with one single unit, like, like your 3 points on one wrist and then the 3 points on the other wrist. But we have taught to treat these points at the beginning of a session, and you can still do this with your massage or manual work or adjustments or whatever you do. But what this does is it drops the stress instantly. So it takes that guarding off of the person. It reduces anxiety levels. It reduces cortisol. It helps them to take a nice big breath and just to calm the system. And it is this fast. You literally hit all 3 of these points for 30 seconds on both hands, and you have a literal autonomic, scientifically medically significant measured shift into a parasympathetic system. And we have measured cortisol shifts through lab samples this way as well. Guys, this literally only takes 3 minutes to do. Okay, so this is another amazing way to shift that nervous system right at the beginning, or even in the middle, whatever. And there's another point right here on the chest. This is a big calming, breathing, respiratory, influential for respiratory. So, but it's a big calming point, parasympathetic point as well. Okay, so this is another way to tap right into that system very quickly. This is the third way, and this is one of my favorite ways because the auricular application for therapy is amazing. Okay, you can treat the whole body through the ear, and it's fast. You don't have to treat a whole lot of points to tap right into the system, but it's really amazing to tap into the nervous system this way. So this is what we call battlefield acupuncture. It has 5 points, and it totally shifts the nervous system in, again, 30 seconds a point in under 5 minutes. We have published papers on this. We have brain scans of this. This is amazing. We have a lot of science. We have lots of autonomic nervous system testing on this. And I do teach a 2-hour webinar on how to find these points and showing you the science from those autonomic tests behind this. So you could do this with every single patient that comes in and then do your other work as well and know that you have shifted the nervous system, reduced pain, balanced their body, and just given them, prepared their body for manual muscle work. Okay, so I love this. This is something that I would highly recommend any practitioner to do. And you can do battlefield acupuncture with just 1 unit. Okay, it's the scars that take 2 units to perform the treatment. Okay, so now the fourth way, what I'm going to show you real quick, is the vagal nerve stimulation with the dolphin. So I want you to look at this picture, okay, because there's 2 parts to our treatment. There is the ear clip. It goes on the ear, right? Either the earlobe or the tragus of the ear, which is this little cartilage part. And then we hook a pad up below the belly button. Now, why do we hook a pad up? Because what you'll see when you're looking at our literature is you will see a D, V, and S. Okay, so yes, we're using the dolphin, but that D stands for deep, deep vagal nerve stimulation. Because remember that vagal nerve ran from the brainstem all the way down into the abdominal area. Well, if we put a pad below the belly button in the bottom of that abdominal area, and we turn that unit on and we are attached to the top, it's going to help to pull that electricity the length of that circuit, okay, or that connection. So we are actually helping to pull the electricity that's being delivered, at or around that nerve down through the body, which is where we want it going, right? Like there can be surgeries and muscles and viruses and all kinds of things that can get on these nerves and little, endings of this vagus nerve and, cause the nerve not to be functioning at its optimal level. Well, by pulling or going deep, we're able to really get that electricity more aggressively down that nerve, okay? So it is non-invasive, which is super the key, because now if you begin to listen and pay attention, there are internal vagal nerve stimulators that are being put in people for this stimulation. For us at NPS, it is a new delivery option, and it is a passive treatment. And this is what is so cool to us as a company, because everything that we teach, the dolphin has always been active. Like our treatment points, our protocols, you have to actually be performing. Well, now this is a passive treatment that you can hook up and either walk away from, or do something else while you're doing the passive treatment, okay? So that is super simple, and it really is making a big difference in home treatments as well, right? It's a deep treatment and it's easy and powerful. Okay, there are some contraindications. Okay, so I'm just going to mention these and then we're going to keep going. I want to be able to share everything here. Contraindications for the vagal nerve stimulation. Okay, not for, these aren't for regular NPS therapy, but this is for the VNS. Active implantable medical devices, pacemaker, hearing aid, implants, metal in or near the neck, okay, pregnancy, cancer, epilepsy or seizures, wound sores, infections on or near the neck, okay. Now, if you are working under a doctor with patients that have some of these, then in your scope of practice still, but with a doctor's order, then you can then follow those doctors' orders and be working with their license, right? So some patients, you just may need to do that. You may need permission from the doctor and have it own a plan of care. But these are the things that you want to be careful with as far as the contraindications. Okay, so now for the how-to, okay? Just remember, when you look at the way it's hooked up, you have white and black. Okay, so you have two pads. You have a rectangle pad, which is a bigger pad. This pad is going to go under the belly button. So if you look down at the bottom picture, you'll see it's under the belly button. And then there's going to be another little pad. So you actually have two pads. One is a round oval pad, and it goes right here onto that silver thumb plate of the dolphin. Okay, it fits. It's cut right to where it will fit. So you're going to put the oval pad on the dolphin itself, connect the two pads. Okay, they have little connectors so that you can flip them all together. And then you're going to put the bigger rectangular pad under the belly. So that's going to be your ground to help pull that electricity down the length of the nerve itself. Okay, so now you're going to have another set of connectors. You're going to have a black cord with like a little cap over it. Okay, so you're going to put the cap over the end or the tip of the dolphin. And then you have a little black ear clip that's going to slide right into the connector of that black cord. Okay. So when you get it and you have these wires and different stuff, just separate it. You have your white, your two pads and your white cord, and you have your little black ear clip, which will go onto your black cord. Okay. So the visual pictures make it easy to separate and put where they go. Okay, so now as far as the use on the pads, definitely it's up to you how you use and reuse your pads. As the company, we suggested that you use the pads for single uses, particularly if a client was sick or contagious, right? So that would work really well in COVID cases, or even for whatever that you feel like is contagious, or that you use and reuse the pads just per that same client, right? So you put their name on it. I will say that as I have taught classes, there are clinics who just clean the pads with alcohol, and actually they say that makes them sticky. It keeps the stickiness, which these are really good sticky. These are really good pads. They are very sticky and will tolerate many uses per pad. But you just have to decide as the practitioner or in your place of business, how you're going to work, the use of pads with a client. But then when you move down to the ear clip, okay, the ear clip can be wiped off with alcohol, and we actually recommend that you wipe the ear clip and you also wipe the earlobe or the tragus, so whatever part of the ear you're going to treat, because it helps if you moisten the ear or the ear clips, it will help you with your connector of electricity. Okay, so when you first clip the ear clip on, you want the little light on the unit to go out, and that shows you that you have a good connection to that area. So if you moisten the skin or moisten the ear pads just a little bit, suggest with alcohol wipes, sometimes I use essential oil just to moisten the skin, then that will help your connected or your circuit for the electricity, okay? And then I'm going to show you when you're doing that, just gently push the cap onto the tip of the dolphin. Don't really wiggle it really hard here. Okay, like once it goes on, you should have a good connection there. But where you can kind of check the connection will be on the next, let's see, slide. Right here, you can see a closer, a close-up of the actual ear clip. So the ear clip is individual and this cord slides right up into it. Just make sure that this is firm or that it has, you know, slid in all the way, and you should have a good connection. So this is what one side of the unit would look like. You would be on negative polarity when you treat. You would be on normal skin type, and then here's your pad, okay? So right here, this picture shows the earlobe. But if you go to this little section of the ear, this is the tragus of the ear, and this is actually the auricular branch of the tragus nerve. So a stronger treatment is going to be right here, okay? The earlobe represents like the cranial part, the faces, the sensory of you know, correlates with the body, like the little upside down homunculus. So this correlates with the brain and the senses and the eyes and the ears and all of that on the body. So you can choose, or you can do both, right? Like maybe not in one session, or you could change it in session. But you know, you could, as the sessions go on, you can you know, change up how you treat just a little bit. Okay. So here's a picture with a difference. So this is on the earlobe, and this one is clipped to the tragus of the ear, okay, which is the auricular branch of the vagus nerve. The VNS, it's really meant to be a passive treatment. It's amazing. It can be used before a treatment or after a treatment, or it could actually be the treatment. Okay, so there are so many options. There's so many different ways that you can do this. It's totally up to you. And I really challenge my students not to get caught in just doing it one way, but be creative, do different things, you know, with your clients. You know, you don't have to do the same thing every single time, because there's a couple of different options here, right? But we do recommend that you start with a lesser amount of time, maybe 10 minutes, 20 minutes, 15 minutes. You can work up to 30 minutes. And if the patient is using it at home, then we recommend maybe 2 or 3 times a week, unless there's really an acute symptom. Like if you read through the book that comes with the Vagal Up kit, because it was geared towards COVID, then you may use, you know, for the first 2 or 3 days, you may actually treat yourself a couple of times a day to really get some changes going in the body, and then kind of taper off to 2 or 3 times a week. So again, this is not exactly a do it this way every time. You have to see how your client responds to it. That's why we say go on low stimulation and go with less time to begin with, okay? And kind of find a balance, because when you're really dropping that nervous system, the nervous system does have to rebalance, okay? And for the most part, we hear amazing things like patients sleep better, they're in less pain. One of the things that I'm getting now seems like it's been recently just tons of testimonies about depression and mood stability, that when they use the dolphin, they're able to move through things and tolerate things that they couldn't before. So we're getting some amazing feedback. This is new. Okay, it's actually only been out for about maybe 4 months now. So so it's exciting. You know, we're going to learn a lot, and it's probably going to help so many more things that we don't even know about. But it's a passive treatment. It can be a passive treatment. Okay, so it can be used before or after, you know, a treatment or during. Okay, but this stimulation targets the vagal nerve, and it's a huge treatment being recognized in the medical field. Okay, so the treatments are targeting this specific nerve, and it is connected to inflammation, digestion, depression, anxiety, and this is the pandemic effect. These are the things that are leaving people's bodies imbalanced. So this is just other pictures of passive stim. Okay, so this was actually my 9-year-old. Okay, one night she just couldn't sleep, so you know, hooked her up for about 10 minutes, and you know, off she went. She was completely calm and chilled out. So as a mom, I do use this to chill out. This was a great couple of great ways just to relax, and then even post-workout. Okay, because again, remember, after workout, you want the recovery. You've taxed the nervous system after you have worked out. So now you want to recover that parasympathetic power. And this passive stim is a great way to do this. So anybody that's really big into working out or working with people in the gyms or working with athletes, and this is something that you definitely want to consider as a recovery. Remember the word recovery. Not only for our sick clients and just for us, like just going through and maneuvering life, but don't forget your athletes, because changing the nervous system is really huge for them. And that's what they're seeking. That's what they're wanting. The treatment can also be active. Okay, so what we mean by that, you hook it up the same way. Maybe they're using it for 15 to 30 minutes while you're doing other treatment things. Okay, so it could be other MPS points. It could be MPS scar release. It could be manual work. It could be massage, myofascial. I have a lot of oil protocols that I do on people, which is beautiful when the VNS is running. But we do recommend that it's a little bit more minimal than like maximum, you know, like, because you're already dropping the nervous system and really targeting that. So just be careful not to do too big of a treatment, you know, as a double whammy, because again, however low that nervous system goes, it does have to climb back up and rebalance itself. Okay, so just go slow. Monitor, you know, your patients. But for the most part, I mean, like it is becoming a huge part of therapy. It is amazing for home treatment, and you know, there's endless opportunities. Okay, so this is it is an additional MPS treatment to the protocols that we already teach. It's cumulative, so yes, definitely. You know, one time will certainly make changes and help that nervous system, but you're going to see bigger changes, right? When you can shift the nervous system and hold it there. And this makes the dolphin treatment super amazing at home because it's passive. It can produce pain and disease reduction, okay, by stimulating that nerve, but it does not replace our other MPS protocols or their purposes, right? So it's just additional. It's new, it's additional, and it brings new changes. So this is just a couple of minute video I want to share. It shows hooking up the system on the patient. It's really quick, okay, just a couple of minutes. And, you know, so watch closely, but it goes through all of those steps that I just took you through. So there's your connector wire, the 2 pads. And then your black clip on the tip. Your alcohol to moisten. That went right on the tragus of the ear. Turn on the dolphin, push the button, and then you got a 15-minute passive treatment. Okay, so super quick, super easy. Okay, guys, so that's it. Okay, that is how easy it is and how powerful it is. So here are a few things that I really want you to know. So if you have a pen and paper or a phone, snap a picture of this. Our website is www.dolphinneurostim.com, so you can find lots of information, read about the unit if you aren't familiar with it. You can also contact me at my email, k.armstrongot@gmail.com. I will be happy to send you more information, send you links to the company, help you get things answered, and just help you learn more about our webinars and online classes. So you're welcome to email me or contact me on Facebook as well. There is a coupon code, VNS-CMC. So if you would like to purchase the device, there's a code and a referral. Okay, my name is the referral. This week, or the week of the conference, of the actual conference online, if you purchase your kit within a week, then you will get an extra book with that purchase, just as a gift. Okay, just, we want to get you interested. We want to teach you about, the dolphin. This is, I miss our online, our live classes so much. I miss my live students. And so we're super excited to be here and to be able to share again at, at the show. And if or when you purchase a new dolphin unit, then you will get a free live Zoom class on how to use the dolphin. It's a tutorial on how to use the dolphin. It goes over electricity, it goes over point finding, just basics, kind of like a little intro of what you would get at a class. And you will have options to sign up for that online. I do those. I do about 3 or 4 of them a month, and you can choose, when it's convenient to sign up for you. But it does help when you purchase your dolphin. It's our attempt to get, an instructor in front of you so that, we can talk about the dolphin, teach you how to use it, make sure you're holding it right, using the point finding abilities right, because we want you to be super successful. So, okay, so let's see, I'm going to stop my share there. So I hope you enjoyed this. I love talking about the Vagal Kit, about the Dolphin Neurostim. I do teach these classes to practitioners. So we have lots of webinars. I'm excited. I wish I could see your faces. So contact me, let me know how you're doing. And yeah, I just love to see who's learning and, help you on that journey. That's my passion. It's my love. The Dolphin Neurostim is something that I have been incorporating on my journey as a therapist for, yes, about 18 years now. And I have done research. I have presented at many, many shows, and have been a teacher for over 10 years. And this is just my heart. So, please consider it as a tool for yourself, for your practice, for your clients. And message me and let me know what you think. Let me know how you're doing, and have a wonderful day. Thank you, guys. Hope to see you later.